Welcome to this episode of Thrive with Us. Today we're talking about online therapy. These days we do just about everything online and through our phones. We do our banking, we do our shopping, we can even have our mental health sessions. But a lot of people are wondering, does it work and does it work for everyone? And to unpack these questions, I am joined by Christi, Lindy, and Maša. Welcome everyone.
Hi.
Hello.
Thank you.
Thanks.
So we're talking online therapy. I know that that's something that really ramped up in the COVID pandemic because obviously we needed to take certain social and physical distancing precautions. It's something that people are still continuing to do.
Yeah.
But a lot of our clients, when they reach out to the clinic, ask, is it for me? Should I do it or should I stick to in-person sessions? And that's what we're going to unpack today. So let's start with online therapy advantages. What do you notice in your clinical work with clients? When is it helpful and when is it effective?
Well, first I want to say that my traditional school of psychoanalysis was really hating the idea of online therapy. It was like a big no-no. Like back then it was like Skype therapy, and it was like, no, we are not doing that. And then during the COVID, everyone had to do it. And now it's even something that is really considered on equal note. So we have International Psychoanalytic Association debating today as we speak about how many hours of online therapy will be allowed in training purposes. So that's the highest and most rigorous standard for therapy, to have your training future analyst in training. And America and Canada are really putting a lot of emphasis on online work, while Europe is still trying to hold back. So it's a big debate, but the International Psychoanalytic Association did approve a lot of online therapy sessions, even in these most rigorous purposes. So with clients, to go back to your question, I mix my work. Sometimes I'm online, sometimes I'm in person. And I can notice, sadly, that even when I come in person, my clients don't want to come anymore. They're like, I'm fine here, it's okay. We are used to this kind of work, and why would I commute? Why would I waste my time in traffic? Why would I go? I usually insist that we at least meet in person. But after that, it's really the convenience. And when you get used to one mode, it really works very well.
Okay, so what I'm hearing from you is that there has been a debate specifically within the modality that you use, and that people are becoming a little bit more accepting and approving of online as a modality for therapy as well as for training. And
Much more flexible, much more.
And the clients that you have, you see them both in person and online, and many of them report liking the online format because of accessibility. What do you notice, Christi and Lindy?
Snap. I wanted to start with a lighter one and say parking. I have had clients convert from in-person sessions to online sessions due to lack of parking. That's just a lighthearted one. But I also think one of the biggest advantages of online therapy is convenience and continuity. Because we're such an expat population, a lot of my clients travel frequently, and the online format gives us the option to keep consistency in the treatment process and not just have big gaps in between when they travel or I might travel. So convenience is definitely one of the big perks in online therapy. And accessibility and choice. I think it gives you the option to really have a wide option of therapists to choose from if you choose online therapy.
For sure. And I think convenience is definitely a big one in terms of the practicalities of it. Therapeutically, some of the advantages that I've seen is that Well, also depending on where the client is and what they are actually dealing with in therapy is sometimes being online can give them almost like the liberation to be able to face some of the things that they aren't actually able to face if they're sitting with the person. So I think therapeutically it can be quite a powerful shift for clients to go online.
Yeah, I love that point. I've had many processes where we were in person, and we just don't get there. And all of a sudden they have an online session from home with their own blankies and their own creature comforts around them. And all of a sudden they just feel safe enough in their own space to open up and to let go. And then the raw stuff comes out. And then some of my clients also report that it was because I didn't have to worry about walking out of a waiting room after I've cried with a swollen face.
For sure. Also actually makes me remember working with, let's say, clients that haven't been able to, or going through a really, really tough time, and that tough time has impacted on their ability to do the things that they need to do. They aren't even able to get out of their homes. So if we limit, or if I'd limited my therapy only to in person, they wouldn't have had an opportunity to start working on the difficulties that they were facing at the time. Yes, after some time and after having worked through those things, then they can choose, or they particularly did choose to transition then into in person. But like that opportunity of being able to work on therapeutically the things that you're going through when you aren't able to, I think is a huge positive for online therapy.
Yeah, that makes a lot of sense. And so what I'm hearing is, in terms of logistics and practicalities, online offers a lot of advantages for people that are watching this and maybe haven't engaged in a therapeutic process. Our sessions are often 50 minutes for individual. They can be 60 or 90 depending on the requirements of that particular client and case. If you're going to add the commute, especially in peak hours, as well as maybe going around in circles a little bit for parking, then that can double, occasionally even triple the amount of time investment that's required. And Christi, you also mentioned that a lot of people do a lot of frequent traveling, and so it does make sure that their care is not going to be interrupted. So I think that makes a lot of sense. And Linda, your point as well about, you know, it feeling like a safer environment, a more familiar environment. And if you are really struggling to do certain things that might not have been an issue before, this is just eliminating one kind of a barrier. So that all makes sense. What are some of the disadvantages that you notice or that you've heard, or some of the hesitations from clients about working online?
What I want to say first before we go to disadvantages, I also think that in today's world, we don't choose things anymore according to what is close to us and according to our neighborhood. So we don't shop in our neighborhood. We don't go to the hairdresser that is, you know, next to our house. We try to find the best, especially when it's something important like schools, education, and then therapy, of course. So it's really important to be able to choose the right person for you with the right center, with the right qualification, and not to be tied to just your immediate neighborhood. I think this is the biggest point for me. When we choose also our supervisors, now we can choose from all over the world. We don't have to choose the one that is living next to us. And that is immense advantage.
Yeah, that definitely makes a lot of sense as well in terms of expanding the number of possibilities that we have for therapists, centers, and supervisors if we're not being localized to whatever is around us. Okay, any other advantages before we talk about some of the disadvantages?
You hear some person speak on Instagram, you get their thought, you like something, you heard them on some media, you really resonated. Now if that person works online, you can actually, contact them and start the process. Before, that was impossible. This is really technology and advancement of our just world in general.
And you're talking about something as well that we haven't touched on yet, which is the fact that a lot of the decision-making process is done through online research. People go online, they look at websites, they look for, video content and other materials to be able to see beyond the expertise and qualifications, but also the soft skills and to get a sense of that person's flavor and their style. So there is a comfort in a way in finding a therapist online, and now we can extend that to also attending the sessions, at least in part, online as well.
Yes, I remember in our time, if you were like a famous psychologist, you got like this little column in a local newspaper, and then you answer some questions about psychology, and then people would like, oh, I really like how that person answered, and I will go to them. So today we have like so much to offer online, so that people can understand is this person like on my wave or not.
Do we click?
Yeah, I see that as an advantage and a disadvantage at the same time. On the one hand, it sets you up to really find a therapist that's a fit for you. And at the same time, it opens up the options so widely that you could easily step into decision paralysis and end up doing so much research, because now almost every therapist is available to you. And then it almost becomes like the dating apps where you have so many options that it also becomes easy to flip between therapists and to go, oh, this one said something I don't like, that one said something I don't like. And then it also opens up the option to do therapist hopping, which is also not ideal. So I think the convenience as well, all of the advantages and disadvantages are I sort of see them as the same thing. The convenience as well, it's very convenient, but that also doesn't mean that it is a quick fix where your therapist can be available to you 24/7, where there's no therapeutic frame anymore, where online therapy becomes a solution for difficulties with planning or scheduling or prioritizing the time. So to me, it's really important that online therapy is also therapy.
Yes.
It's not a quick chat with a friend. It's not something that you just log in and log off when you are comfortable with it. It is still a formal, schedulized appointment where you get up, you dress up, you don't log in your PJs, although, confession, a lot of us wear slippers while doing online therapy. I had a moment of thinking, should I show up for this podcast in my slippers to keep it congruent? But it's important to also see it as therapy and to respect the frame and to prioritize it as something that you're doing for yourself and your own self-care, and not a quick fix to stick a plaster on and to have a therapist that's available all of the time.
I think that's a really important point, because at the clinic, whenever people are inquiring about starting a therapeutic journey with us, we ask them, are you looking for online, in person, a combination, just to kind of get a feel on who might be able to match them in terms of availability, the medium, the presenting problem, etc. And often clients will ask us, well, what's the rate for online, based on the assumption that because it's online, because they're not physically visiting our space, that it should be at a less expensive rate. And our reception team knows that the answer to that is, it is the same price, because it's the same service for what you just shared, Christi.
Yeah.
Just because it's online and just because it's convenient and just because you can do it 1 week in a hotel room when you're, in Saudi Arabia, for example, for a work trip, or another week somewhere else because you're on holiday, or from the office because you had a last minute meeting and you weren't able to actually come into the clinic on time, doesn't mean that it's any less of a therapy session. It still has all of the same bells and whistles, if you will. It's just in a different format.
Yes, that was clear from that was clear from the start that the value is the same and that setting is rigorous. But though we have I do have some difficulties to enforce the setting with teenagers, especially when they are hiding from the camera and take a vape, or they are, eating, or even, chatting, like I'm not seeing that they're doing something else on the other screen. I mean, it's the part of the process, and it's difficult. We do say that children actually cannot still, like in like this most traditional school of thought, like the children are not supposed to work online unless they are 13, for example, 13 or more, or maybe there are some very mature 12-year-olds. But this is maybe the difficulty to keep the setting straight, because in your room they just there is no phone and there is no vape and there is no food. And sometimes it's maybe difficult to explain why we cannot have these things and why this 45 or 50 minutes has to be in a certain format that is extremely important, because only in that format the magic of therapy can happen.
I just wanted to say I do have an understanding of why people do have that expectation of the difference in pricing or the rates between online and in person. And I think it's obviously over time there has been developments, but even with health insurances, they would reimburse differently, whether it is teletherapy or it is in person. They made those distinctions, and so people did then will make a decision about whether choosing online or in person based on that. So I do have an understanding on why there are those expectations.
And I think the health insurance approach, or the way that they look at online, has sort of shifted, at least in our environment. When the COVID pandemic happened, very quickly it was accepted, it was viewed and seen as being exactly the same. And many of our clients are fortunate enough that their policies don't differentiate and will cover the sessions, whether they're online or in person. But there are definitely some that do not think that it's part of the coverage. So that is a potential barrier, and it can trickle down into the inquiry process. And Maša, for you, it's a very interesting point, and I think all of us have probably faced this, having online sessions. We can't control the environment, and we can't also see everything in the environment. We can only see what the clients allow into that frame. And, sometimes they think, especially teenagers can be a little bit bold, that they can get away with that, side eye, and you don't know that there's, a phone under the table. What are some interesting encounters or experiences that you've had with online therapy? I'll tell you one thing that happened for me. This was years ago. I was seeing this lady, and actually, it relates to the health insurance. She wanted to do a couples therapy session, but couples therapy wouldn't be covered on their health insurance. And our policy at Thrive is, we just do everything super above board. If it's couples therapy, it's couples therapy. And she's like, but I want him to hear what it is that, we're discussing. And I'm like, well, we can talk about that. We can come up with a summary, and we can sort of explore that in our discussion. And I just got this sense. I just got this sixth sense And I'm just like, are you alone? And she's like, and you just sort of feel a little disturbance in the environment. I'm like, you're not sitting in the same way you normally do. Like the body language, even the positioning. So yeah, I busted someone trying to attend a therapy session.
Wow.
I so hope there was a moment where she looked at her husband and went,
yeah.
Did you hear the therapist said my emotions are valid?
Yeah.
So that was an interesting one.
Yeah.
I'm sure you've encountered your fair share of things. What do you remember?
One of the ones that pop up for me is I logged into a session once and found the client like this instead of like this.
Oh.
And then the client had logged in from bed.
Oh, wow.
She was in bed in her PJs with her phone on a pillow. And I'm like, no, not quite. I don't think this is going to work.
Yeah. And I think, if people are taking their sessions from home or from another space, we make allowances for the fact that they might not have their own private place. Many people will take their calls from the bedroom, and even seeing the bed in the background, I think is okay.
Yeah.
But being on it with this sort of a view, probably not ideal.
Yeah.
Why is it not ideal? Can we explain that to the people watching? Why should we not be doing therapy when our clients are in bed, on bed?
Well, there are many situations like this, and it comes back to this setting that is so important. It is just the proper frame for therapy to work. And if we break this frame, then it just doesn't work that well, or it doesn't work at all. So maybe boundaries would be the topic here, accepting that, you have to accept some boundaries. And that is such a valuable lesson in life in general. Like what is okay, what is not okay. If this is the frame, and if we say this is how it works, it's yours too. But everything then in therapy is again the material and the food for working in and working about stuff. So I often use with my clients exactly these imperfections to discover something very fascinating behind it. Why was it important for someone to eat while we are together? It's not about this is the only 5 minutes in a day when she can do the lunch. It is about maybe that me as a mother therapist and her as a baby child, which is very often metaphor in therapy, that the feeding and the nurturing was something important. And actually, when this interpretation came to her, she was a bit stunned, and then she didn't have a need to continue to do that anymore. With teenagers nowadays, these boundaries are extremely difficult to, in general to keep, and the online therapy gives them a little bit more advantage on that field. But this is what we are working on. So we are using this material to work on the things that are actually very important topics for therapy.
So the frame is important, and people need to show up in certain ways. There are certain boundaries and expectations. We communicate that to clients in our informed consent and onboarding process. I would imagine that you review that with clients, especially if something seems a little bit out of the ordinary. But Maša, what you're sharing as well, if I understand you correctly, is when something comes up, if you find someone in bed, on bed, vaping, eating, whatever it is, that's therapeutically relevant information, and that's something that you can incorporate into the process. And sometimes it shifts their behavior, and sometimes I would imagine.
And it's not only about shifting behavior, it leads us to something very deep from where that behavior came, and that is a very valuable insight.
Yes.
I just want to say something more about disadvantages of therapy. There were certain occasions where people were trying to record the session, and then we cannot also control that if we we don't see it from the computer, but if there is some external device. And we all know that it's strictly forbidden to record the sessions, even from therapist, client, or whoever. So this is, for example, one of the factors that we can only rely on somebody consciousness to really obey the rules. But this is strictly illegal practice, and people need to know that.
Yeah, and similar to Lindy, I get where they come from. I want to have a record. I want to be able to listen back to this. Those are the advantages. But the limitation is that you don't realize how it affects your safety. And the minute your session is being recorded, you are infringing on your own confidentiality, and your nervous system will register that. You will not feel as safe. You will not be as open and transparent and comfortable as you can be. In in-person therapy, we can help you with that. We can make sure the doors are soundproof, the room is safe, no one can overhear you. We can take more responsibility for the confidentiality of the session, where in an online session, that responsibility is shared. I can make sure that I wear my earphones so that only I can hear the online session, but the client has a share there too, to make sure they are in a confidential space. Nothing's being recorded. No one can overhear them. With the confidentiality thing, and linking to the example of the client you had who wanted her husband to listen in, I can very often see in the body language of the client, someone just walked past the bedroom door, the conversation will pause, the body will tense up, and then they'll go, wait, are they listening in? So I think that is also part of why the frame is so important, is to make sure that you have that safe and confidential space. And there, I admire how much effort my clients put into then prioritize their sessions. When it was the COVID lockdown and we were living in small confined spaces, I've had therapy sessions with people sitting on the bathroom floor to find a safe, confidential space. I've had therapy sessions with clients in their car, sitting outside home to find that confidential space. And I think that's what I mean with prioritizing the therapeutic frame. To me, it's about safety and prioritizing that time as yours and safe and protected.
Yeah. I wanted to go back to the different things that we've experienced. And for me, there's a client that popped up in their 30s, in a job that was highly pressured, I'd say, very busy. And they'd presented for like anxiety and stress management, and they were working a lot, traveling a lot. And so initially, doing online therapy, CBT, managing anxiety and coping, like that really worked well. But I noticed that when we were starting to sort of explore the emotional parts of the presentation, then I started seeing the multitasking. I started seeing the switching on and off, the camera going off at particular times of our conversation. And that for me, again, was the material that we used to sort of reflect on that work, and to see what other options do we have, and to be able to tap into that and really do some deep work when it comes to that. So
that's really interesting. And I think just to kind of emphasize about the safety in this space, seeing someone in a car can be okay, right? If it's a safe and confident, if that's where they can find. If it's the bathroom, as long as they're not using the bathroom, I would imagine it's okay, right? I mean, we saw horror stories, not in psychotherapy, but like in COVID, a lot of funny things were happening. So it's not about where you are and what's in your background, but what's really important is that it feels like a safe and confidential space. And the responsibility is with the client at that point, because they're the ones that have access to manipulating or changing their environment. We can't do anything outside of the clinic. But it's interesting about the recording piece. So again, I think we emphasize this. It's not allowed. It's breaking confidentiality. It's illegal in our space. And also, it made me think of an experience that I had when I was still working as a professor. And I used to have students who wanted to record the lectures. And I told them that I don't allow that. And the reason that I didn't allow it in that not confidential environment is because it's kind of like going to a concert or being on vacation through your phone. You know what I mean? If you are relying on technology to capture a message or a moment, is that going to prevent you from fully engaging in that, right?
Yeah, I see it as similar to having a notebook and wanting to take notes of everything, to remember everything your therapist says. But then you're so concerned about taking notes and remembering everything that you're not really present and experiencing the input. And there, I often say to clients, there's wisdom in your psyche and you will remember what you need to remember. The process is a process for a reason, and whatever needs to come up in your psyche is what will come up.
Any other thoughts around some of the challenges or any other interesting anecdotes and how you navigated them with the online?
One thing that I love about the online work as well, and a hybrid approach where you have the in-person sessions and the online sessions combined, is having those moments of seeing clients in their safe spaces. So, for example, I've had a client tell me about how meaningful their cats or their dogs are to them. And then we're in session and all of a sudden the precious cat walks over the keyboard. And pets, and seeing how they respond to the emotions in the room. As we are moving and we're going to deeper places, then you'll hear the dogs react and the cats come closer for a cuddle. So maybe online therapy sometimes involves into an animal-assisted approach where you have additional regulation and information from the animals around you.
I think some of disadvantages, not really, but like some of the challenges that have come with online therapy, not on the client side, but I'm really reflecting probably on my own journey then. I practiced online, in-person therapy, as Maša was saying, being trained in a time where that was the ideal and the only way of doing therapy. So the transition then for a therapist to move from in-person to online, and some of the things that I had to upskill on as a therapist, and just managing different things from as simple as, what do I do? It's not linking, or something goes. Technology does what technology does. And then how do I calmly? Because I think it's important for me then to be calm in that situation as my client is looking at me. I'm frozen, they're frozen, like all of those things. How to manage that in a therapeutically helpful way, and those were some of the things I needed to, as a therapist, reflect on and learn how to manage.
And that aligns with the latest research on online therapy versus in-person psychotherapy. So the latest research shows, in terms of efficacy and symptom resolution, on par. Both of them are equal. The one thing that affects the efficacy is the therapist and the client's confidence with technology.
Yeah.
So if you don't like technology, then maybe online therapy is not for you. And the other thing that the research showed was that clients reported feeling a stronger therapeutic alliance in in-person sessions. But despite this, the efficacy in reduction of symptoms stayed the same between both. So in that sense, the hybrid approach is what I love most, and I feel it brings together the evidence on it.
I think there is a paradox around online therapy and therapy in person in terms of closeness. So in a room, we usually say that we feel like closer because we are in the same personal space. But actually, on the screen, your therapist is closer to you.
True.
Because all the emotions are more visible, and we are focused on this emotional part of our mimic and all. So it's very weird because you feel that even it's more close and that you are more vulnerable and more close with your therapist. But then again, in person, it feels like we are maybe sharing more bodily information. Like one of my clients who is also using mixed approach, he likes to say whenever we come in person, he likes to say, "Oh, a body attached to the head." He's always like a little surprise. But then there is a little bit about this transition. But as I notice, if you change frequent enough, even transitions are not noticeable anymore.
Yeah.
Go ahead, Christi.
I love how you explain it. I often explain it as my experience of it is that it's two different types of intimacy. In in-person sessions, I have the whole body to work with. I have the body language. I have the hands. I have the feet. I have I have the body with the head. When it's an online session, I have those little lines, If we link to the Gottman work, you see those lines of contentment and disgust come up in the facial expressions. It's different information, but you get to the same picture in the end.
And I think what you're saying about the hybrid approach working well is very valid because there are some strengths and challenges with each of the approaches. For me, I had some clients that I saw over COVID, and so that was exclusively online. And then after, I was back in the office, I had a couple of them come and visit, and I will not forget, there was a couple, I had only ever seen them online, and when they entered, where they sat also on the couch. And what their body language was towards one another was very, very relevant. Online, they would either be sitting side by side touching because they need to fit into the same screen, or they would be, dialing in from different locations. And you don't also want to read in too much to that because sometimes people are online because one needs to be in the office and one needs to be at home or whatever. So that just kind of was information I would never have had if we had continued to work online. So I can see the utility of the mixed approaches. And I think the technology piece is really important. So what you're saying, Christi, based on the research is it can be effective. People are reporting that maybe they feel less close in certain ways, and that the biggest issue or challenge is when there are snafus. And there are always going to be snafus. We, in our clinic, use the most compliant, secure tools for conducting those sessions so that we can really safeguard confidentiality and the data that's, being transmitted in our systems. We don't have control over people's batteries. We don't have control over people's network. And even regional, I don't want to say global, but neighborhood specific disruptions. And unfortunately, because people are showing up for therapy to a session with us, if any of those things go awry, a lot of the time there's that frustration of, this like online therapy appointment. But what I'm hearing from you and tying back to what everyone has shared today is that's also kind of relevant and meaningful information in terms of, you know, how what it's symbolizing, what it's bringing up, how it, you know, connects to maybe the thing that brings them to therapy, and also some, you know, contingency planning, which is an important life skill.
Yeah, that's the online therapy equivalent to not finding parking is your battery's dying or the connection is dropping or something is going wrong and you're muted and your microphone's not working. So I think it's important to acknowledge that it's not one or the other. Both will have their frustrations. Both will have pros and cons. One is not necessarily better than the other.
And in a systemic family approach, this is very important when the family comes in or the couple comes in, and where will they sit and how will they interact. But actually we have a pendant to that online, you know, when one is taking the camera, putting it on itself like the other.
Very true.
Or one is, you know, sliding away, fading away, and one person is more loud. So actually we get to know all these details as well. It's
in a different way.
It's just a different way.
Yeah.
Okay. Any other thoughts on online therapy? How, if someone's watching this and wondering, what should I do? I know that kind of where we're going in this conversation is very much in line with all things psychology. It depends. It depends on a number of things. So how should people assess whether online is the right place to start?
One thing that's coming up for me now is because I love online therapy so much, I'm always about declaring my bias. I really enjoy it. It's also to consider whether it really truly is indicated. So I think one of the big things is risk. If there is risk of harm to yourself, risk of harm to others, if you are in a space where a therapist might need to rally resources around you to make sure that you are safe, then online therapy might not be the best fit for you.
But that said, that was my first thought as well. But I must say that experience just kind of, you know, changed that for me, because I have a lot of clients that are risk clients and they work perfectly online. So even the risk can be contained online.
What are some of the things that we need to be sure of? So let's take a scenario, for example, of this person is working with us exclusively online, and that's because maybe they started the process while they're in Dubai, but they're spending a lot of time working abroad, or they've moved abroad and they don't want to discontinue.
Yes, teenagers going to university. This is a very often case. We were working for a few times per week in person, very intensive therapy, and then they move for university. So we have to continue that work. And it's perfect, I must say. There were no obstacles.
So in a case of risk, I would imagine then, because they're living somewhere else where we might not be able to deploy resources in the same way that we can here, making sure that we have the relevant emergency contact information, that we're able to kind of signpost them to any emergency services should the need arise. So it's just maybe doing a little bit of research and orienting the client to the relevant services if they're not here in the UAE.
Yeah, I think the distinction is between a new process and an ongoing process there as well. With an ongoing process, I think it's about getting the client to set up a safety net, rallying the resources, getting a treatment team there, that the client mobilizes themselves in case of emergency. Who do you phone? Who do I phone? All of those kind of things. Where if it's a country, the client is in a country that I'm not familiar with, I won't even know where to start in terms of who to phone if there is an emergency that needs to be handled and the client is in acute risk. So I also think the acute versus chronic risk factor plays a role for me.
Yeah.
If it's very acute and it's one of those instances where I'll need to phone someone and assist and jump in, there I'm a little worried. If it's a chronic risk and there's an established relationship already and we've had a process where we've spoken about what do you do in case of emergency, what is your nearest emergency department, those kind of situations, then I think online therapy is a comfortable fit and can.
But I think the factor there is actually where are their close people?
Yes.
Because we are not emergency service. Anyway, we wouldn't be able to do anything for that person physically in that moment. So all is up to, do they have anyone close who can attend to them? And that we can, get in touch with. So it's about other people being personally there, and us being online is perfectly fine.
Yeah, building the safety net for them.
Okay.
Another sort of consideration whether to do online or not, again, therapeutically, thinking about, I think a person would need to almost know for themselves if they are the kind of person where online the screen would be a barrier or the screen would be a safe place for them to talk. So that is something that I would sort of consider, also thinking about what they're presenting with. I'll go back again to the same client where initially it was a CBT approach, and online then was a good fit. But when we were working with the emotional stuff, that was linked to the anxiety that they presented with. So that was more fitted for in-person. So where they are in their journey of their presenting difficulty will make a difference of whether we choose to go online or to do it in person. So their therapeutic journey
Their
plays a
therapeutic
difference.
journey, and then their preferences as well, and how they kind of interact with and see technology as a tool for that process, or whether they see it more as a barrier. And one of the things that people can do is you never really know until you try.
Yeah.
And I think that a lot of people, and you joined us right before COVID, right? A lot of people were very, very reluctant, but COVID, obviously, there was no other way.
I was reluctant. I was like, no.
I know.
But then
And then what happened?
you get into the water and you realize, oh, this is nice.
Yeah, it's not so bad. And
It
for some
works.
people, that's also their preference. So try and see. Maša, you said that for children, in your view and to your knowledge, younger children don't do as well with online therapy, perhaps because the focus, I don't know. I know that some parents are reluctant to do it because for them it represents just another form of screen time, which is something that anyone with children is always sort of trying to manage. So what are your thoughts about children and online therapy? Is there a way, is there a type of profile, or can we do a hybrid approach for the younger than 13, or should we really try and stick to teenage and above?
I do try with 10, 11, 12, but it depends. But for younger children, it's really about, then I recommend just parental counseling.
Okay. I work mostly with 12 and above, and for them, even on that spectrum of 12, the ones closer to 12 work better in person, and then the slightly older adolescents do actually quite well online for the various reasons that we've discussed today.
Okay.
I think.
So
that's the
it
age.
continues to depend. However, we're thinking that teenage and above is usually more likely to fare well therapeutically. Christi, any thoughts on that? I know you don't work with kids.
I don't work with kids at all, so I tap out on this one. I have no comment.
Okay. All right. So what I'm going to do now is I'm going to pull up some questions that I prepared for you.
Okay.
And I just want you to have your knee-jerk gut instinct reaction. Some of them are in line with some of the things that we've talked about.
Okay.
All right, ready?
Right.
One thing online therapy does better than in person.
Convenience.
Okay. Convenience. One thing in person will always do better than online.
Not being able to hide.
Okay, I like that one. What's something clients don't realize about online therapy? For someone who hasn't started the journey, what's one thing that they don't realize or they misunderstand, perhaps?
That it works.
We talked about this a little bit, but any other funny tech fails you've had in a session?
For me, it's the funniest when the screen freezes in some place. It's really self-conscious and uncomfortable. Yeah, but it's
And then
okay.
I often tease that it's always in the most important moment
Yes.
when I'm saying something really meaningful or the client's going to a deep emotional moment and then the screen goes.
But saying that, Christi, we have to say that these are rare moments and the technology is working and the session, usually 90% of the sessions are going without
So
that
disclaimer
problem.
to anyone wondering about online, it works most of the time and we manage if it doesn't. So don't worry about that.
These are rare occasions.
But sometimes
usually,
it freezes, and I've had occasions where, and I mean, this is something that happens to me with my own personal phone use. You know, when you're like holding your phone and all of a sudden it drops either on your face, on the floor, and then you hear the thud, and then the camera kind of goes this way and that way, and you see it like reorienting. But like often it's a moment of comedic relief.
Yeah.
For me, it's my earphones falling out and dropping under the table, and I'm like, oh, wow, what am I going to do
How did I get there?
How did you get them? What did you do?
I just dealt with it as congruently as I can and went, well, I'm sorry, I just need to go and down here and dive. And now I've problem solved. I have little hooks that go over my ear to keep them in place because I've realized that when I speak, I get quite animated and then the earphone just goes clunk. And it's never like a delicate fall out of your ear. It's always a big
Production.
right there.
And one more thing that we don't have to be aware of in in-person sessions. For example, I don't write ever during therapy, but in the first session, I write down the notes because there are plenty of information. So in this first session, like after some time, I realized that online, I'm just looking down and doing something like the person has no clue that I'm writing. It feels like I'm disengaged and looking something on the floor. So I always remember in the first session to say to my clients, when I look down, just that you know that I'm writing.
Yeah.
But otherwise, like you naturally wouldn't think of that.
Yeah, that takes me back to the concept of context, that with in-person therapy, we know we're physically in the same context. And what I do find with online therapy is that I work a little harder to explain my context, to understand what the client's context is, where they are, where they're coming from. So that's a really important point, is the context variable.
And now it's easier when like a lot of video modalities are blocking the background noise.
Yeah.
But sometimes it happens to me that really my neighbors are so loud that it sounds like they're in my room. And I'm like, oh my God, how will I explain to the client that I'm perfectly alone and this is confidential space because they feel so loud. But now it's better with this blocking system.
Yeah.
A moment for me, sorry, to just go back to what I do, EMDR therapy. And with EMDR comes eye movements. And one of my moments was in the middle of a bilateral stimulation doing the eye movements. Then technology does, and it froze. And so just missing how long the person would be doing those bilateral movements. So also the kind of therapy that you are doing and the impact it has on technology.
But it's pretty amazing to know that EMDR can still be done and can still be effective
Absolutely.
online.
Yeah.
So, okay, so final question. Does online therapy work, and would you recommend it to your nearest and dearest, either as a standalone or as a hybrid?
It definitely works. And it's not just our thoughts here, it's research based and proven. So there has been plenty of research done, and it's like the result is very, very unique. It does work. It's very effective. It's really up to your choice and what is more convenient to you. I would recommend it to, everyone, really, even my closest. I would recommend to, try both, not to be stubborn about, I don't want to meet my therapist. You should meet your therapist if there is opportunity, but also not to be stubborn of, I don't want to continue therapy because now they're not available in my town. No, you should push yourself in either direction because it really... it's a kind of superficial difference. It's not like something deep. And, if it can replace the work on couch, like psychoanalytical work on couch, then like it's really there. It's funny how you because when you're on the couch, psychoanalyst is behind your head, you don't see them. So how we replace that in online therapy is that first we say hello, like you would come into the room, and then we switch the video off so that you are like lying on the couch and looking at your ceiling, and the recommendation is that you really lie on your couch.
So there's an online simulation for that too.
It's a completely online simulation for that too. Otherwise, if you are not on the couch, which means at least 4 times per week, then you have to have your video on. It's not an option to be off.
And that is in the modality that was probably the most resistant to online work.
Yeah. Yes, definitely, absolutely. I would recommend it to my closest and dearest. I would say a sweet spot is hybrid, being able to have the choice of being able to do online, but also be able to do in person as well.
I would also say yes, I would recommend it to my nearest and dearest, and I would challenge all therapists as well to really make decisions in the best interest of your client. So to my advice to my nearest and dearest will be to ask your therapist. And if your therapist feels online therapy is a good fit and is indicated, they will work that way. If there are clients where I feel maybe in this case online therapy is not a good fit, I will say that because it's not about me and my preference and what's comfortable for me. It is always what is in the best interest of the client and what serves this process for this client rather than a generic all or nothing decision.
Okay, so the general summary of our discussion today is online therapy does work, it is effective, it is useful. However, there are certain considerations that people need to be aware of and to make as the clinician and as well as the client, and that often a hybrid approach can be particularly effective because it draws from the best of both worlds. Thank you all for your time. I really enjoyed this discussion.
Thank you.
Thanks.